guess that's a part of kind of the struggle when implementing super, I guess, formatted or highly structured notes, where I remember many years ago going to doctors and saying like, all right, well, you just got to go through this list of 100 checkboxes that are yes or no, and you have to check them off. And that's how we're going to know what this should be billed out as. But I think what we learned in that process is that like, that's not generally how doctors like to practice medicine. The narrative is important. The SOAP note format is still widely adopted and used. And so trying to put a physician or any other clinician in a box and saying like, all right, you're just here to check things off and go down a list, like that isn't exactly the way most people like to practice. Has that changed at all? And it seems like the narrative is as important to most practicing providers as it ever was.
Yeah, I would say you're 100% right. And, having a strong practice manager in-house that understands that and can work, in concert with an outsourced billing company is really key. I think that having that second set of eyes, but having somebody in-house that knows or can be in contact with the physician to guide appropriately is really helpful too. And that's a missing piece in a lot of practices. It's a piece where we step in often as interim manager, or we can coach somebody, we can train. We're working on currently on about 15 different platforms right now. So we're intimately familiar with the back end of it and can coach accordingly with the in-house biller to work with the physician to make sure that they're documenting appropriately as well.
Got it. So long story short, you don't see a near-term future where the EMR does it all for you and it just magically happens, and the regulatory requirements and billing changes are going to get simpler. It seems like it's as complicated now as it's ever been, which is why it's really important to know your stuff.
It really is important to stay abreast of the carrier rules and regulations, to understand the requirements, to understand the implications for the practice financially speaking. And again, I wouldn't say that the carriers go as so far to make it so complicated that you can't collect, but it sometimes can feel that way. So really, again, that's where we step in. That's where Svast plays an important role. We stay ahead of those. We educate the practice. We bring those changes to the table long before they're implemented. We review with the practice. We make sure that if something needs to happen within their system, to account for that and to allow for that, or if there's some training at the front, that we also educate.